Hi everyone, happy Friday. Welcome back to Ultrasound Unplugged. I'm Destiny, and today we're going to be playing a fun game called Fact or Myth. We've done one of these in the past before, but this time we're going to be continuing on with our IVF series. So it's going to be an IVF Ultrasound edition. I'll throw out some statements we often hear from families or from patients, and then I'm going to ask Christopher here if he thinks that it is a fact or a myth. And he's going to give us some real answers today for you. So, are you ready, Christopher?
Hi, I'm Christopher. Yes, I'm ready.
Okay, cool. So, my first thing I'm going to say is that most IVF patients need more than one ultrasound during the process. Is that a fact or a myth?
That is a fact. Families typically need several ultrasounds before they start treatment, typically 3 to 4 during treatment, and also for monitoring. Monitoring, it can be anywhere from 5 to 15 to 20.
It really depends on.
It could really get up there in number.
People have been coming here for years.
Yeah, I think we've had some that have had like 20 to 50.
50, yeah. I've seen some.
So it could actually be a lot. So that's
why we try to make it as easy as we can. So yeah. Fact, they'll probably need more than one for the most part.
That's okay. It's just our coffee machine.
Yeah, if you hear that in the background. We're going to move on, though, to our next one. So, insurance, or my next statement, I guess. Insurance always covers IVF ultrasounds. Is that a fact or a myth?
That is, unfortunately, a myth. Mm-hmm. It would be nice if we could get insurances to cover everything. Mm-hmm. But unfortunately, there are some plans, specific plans that do not cover insurance, do not cover these scans. Mm-hmm. And this is one of the reasons why we've set up some of our IVF packages. Yeah. So we can accommodate for those that have insurance that don't cover it. Mm-hmm. Some of them are a little more difficult to get authorizations from. I'm not even sure if some of the HMOs will even come close to covering it. Yeah. We don't have a lot of HMOs that we bill that actually cover it. Have you seen
it would be very difficult, I would say, unless they have like some sort of out-of-network benefits, which a lot of them don't, I'd say.
I can't think of, off the top of my head, any ultrasound.
Unless they have like a healthcare account balance, maybe.
That would be the one thing that they would be able to possibly
maybe if they would let
HSA
them.
Or something like that, where they have an account. But
we'd have to double check it, obviously. But I know at the Walk of Hope that we did back in earlier this year, they were actually saying that part of the reason they did the walk was because they wanted to try to get awareness and work with different insurance companies across the country to get them to cover it, like to see it as, pregnancy-related ultrasounds, right. In a way. So hopefully that happens within the next few years.
Companies are, Patient Fi, you've got...
they're
starting to Care Credit. Mm-hmm. We're starting to come up with more things that give them more easily access than just, okay, your insurance isn't accepted.
Yeah, not everyone even has insurance in the first place, so...
True.
Mm-hmm. Okay, well, I'm going to move on to my next one then. So, ultrasounds at hospitals are usually more expensive than at independent ultrasound facilities like us. Is that a fact or a myth?
I hate to say it, but this is a fact. Mm-hmm. At least from my perspective, it's a fact. I've never had anybody come in here and say it's cheaper at the hospital.
Yeah, I don't think I've ever heard that.
The primary reason for that is because they have a lot of overhead. They have a lot of machines that are way more expensive than our machines. Like this machine right here, this is for echocardiograms. It's an ultrasound machine. It was $55,000. They have machines that are $1 million and a half.
Gosh.
Yeah. So it's way more overhead than we have, and so we don't have as much.
It's still good quality though. Do not.
Oh yeah. This is a Philips. All of our ultrasound machines are either GE or Philips, and so they're high-end ultrasound machines. It's just not $1 million, and it's not a 70 to 80,000 square foot hospital. So we just don't have the overhead that they have, and we don't have to pass on expenses that we don't have to them. So it makes it a little easier for them to kind of figure out, hey, this is more cost effective to be
Yeah.
here than to try to go to an imaging center that is attached to a hospital. Not to say that they can't do their job and do it well. It's just they have a lot more expenses than we do.
Oh, yeah. But I haven't really seen many IVF patients specifically go to hospitals for, like, their monitoring ultrasounds. But even still, I mean, I would think that, a lot of people come to do their monitoring with us a lot of the time because, like, CNY is based out of New York. So it's way more difficult to have to go to New York and back just to do, your follicle count ultrasounds for the most part. And so that's another big reason why, other than just affordability, that it would be better
flexibility
to do, like, independent imaging facilities, which a lot of the IVF companies are now starting to, like, outreach to do that, I think.
And I think this is one of the reasons why we're getting inquiries from places like Positive IVF. The other, what's that young lady over at Elena?
She doesn't have, her name is Elena Klimov. She's based out of the Woodlands in Houston.
It's that reason that they're reaching out, because there's more access, more flexible access, as in we can see patients more readily available than some of the other facilities.
And without having to go downtown or anything either.
It's just...
even Houston, driving to downtown is really, really annoying.
And I think that's the thing. Nobody wants to go downtown.
Yeah. Not at all.
I have no reason. I can't think of anybody that just wants to go fight traffic.
Right.
Especially to do...
like in the medical center, too. No.
You have to pay for parking, and so it gets a little tedious.
But so yeah, that one's going to be a fact, right? That's where we're at. So the next one, I'm going to go ahead and say that you always need a referral to book an IVF-related ultrasound with us. Is that a fact or a myth?
With us, that is a fact. Anytime a patient comes in for a AFC or a IVF monitoring, we do require that they have a referral with them or have it faxed in prior to, so we can make sure that we get the appropriate exam done, provided by the appropriate ordering physician with the appropriate codes, to make sure that we're doing what we're supposed to be doing and not something that we're not supposed to be doing.
And a lot of the time also, I mean, your doctor can send over, we've had people that their doctor sends over referrals in advance, so we just have them on file, so you don't have to keep like reaching out to your doctor to get them sent over to us.
Some of them have marked on it continuing care, meaning as needed, and so that makes it super easy if you want your provider to market it as needed, and that way we don't have to, or you don't have to, or anybody doesn't have to keep calling the provider to get updated documents. We can just keep it on file and just continue to scan as necessary. That CNY does that. That's really pretty user friendly for the most part, but we also, with the IVF, we also even though you might need a referral, if you're coming from out of the country, we still take those as well, which is helpful. But then another thing that we do that doesn't need a referral, which is not technically an IVF ultrasound within itself, but we do a fertility first step, which you can look on our website for more of the details on it if you're listening. But it's basically, a fertility kind of exam for you and your partner. It does the semen analysis for the male, and then it also partners the ultrasound for the female. So it's a combination.
You don't need an order for that, which is big.
It's a combination for the two. You don't need an order for that. You do have to prepay the package, actually perform the analysis, and then do the ultrasound exam.
Yeah. But like I said, if you want to know about that more, you can look
check
on
us out on the website.
So I'm going to move on to our next one, which is going to be that IVF ultrasounds are painful. Is that a fact or?
That's a tough one. I'm going to go with a myth, because
I would say it's a myth too. I mean, I've never gotten an ultrasound like that before. So, I would say it's only pain. It depends on the person, obviously, right? I mean, in general, our techs would probably say that they're not painful. They might be a little uncomfortable. That's a better word for it, right?
Yes. Yeah. I've never had a transvaginal ultrasound, so I'm gonna go out on a limb and say they're not painful, but they may be slightly uncomfortable from what I've heard from sonographers that have performed them, and had comments back from patients. Maybe a little uncomfortable, maybe not so much because of the exam, but because they may just not be used to doing exams like that.
I'm assuming once you, like, you know, we talked about how they do multiple. I'm assuming, like, once you've done a few,
right?
And you do maybe like 3 in like a week and a half. So I mean, I'm sure you might get used to it, but also, like, I'm sure our techs would work with you if you're in pain. They're not going to keep on trying to get it with the transvaginal ultrasound. I would think they would try to work some way to make you more comfortable.
I would think after like the 3rd to 5th time, it's like riding a bike. You know, you're there. You probably get used to it.
And I'm sure if they're already in that process, they're determined to do what they need to do.
And again, I apologize. I'm speaking from my perspective.
Me too, though, because I really don't know. I mean, I can only tell from my perspective as a girl, like, what I would think.
Right.
So, moving on, though. So, the next one, IVF ultrasounds expose the patient to radiation. Is that a fact or a myth?
That's definitely a myth. Ultrasound is sound waves. Radiation, we don't have.
X-rays and MRIs,
we don't have radiation at any of our facilities. Everything is ultrasound. Fortunately, you don't have to worry about that. Ultrasound is safe. You can do it repeatedly. We look at your baby with ultrasound. We look at your kidneys, your heart, your liver. So it's not something that you ever have to worry about, or, you know, if you're feeling, if you're anxious, don't be, because it's just not harmful.
It's not harmful, yeah.
And so that actually helps out tremendously, especially if somebody's going to be doing something like this over and over again.
Yeah, all the time. Can you imagine?
Right.
I don't think that would be allowed if it was with radiation. Oh my god.
Yeah, so this should help patients that are coming to do IVF monitoring kind of put their mind at ease. And they're already having to worry about, obviously, not being able to conceive. And so in the grand scheme, hopefully that one extra thing can help kind of calm them down and get them into a better state.
Yeah, it's true. So we're going to start 8th one, I think. So I'm going to say right after, so, you know, if you're in the IVF process, there will be a transfer. And if it's successful and the patient ends up being pregnant, let's say, the first ultrasound will show a heartbeat. Is that a fact or a myth?
That is a myth. The first scan usually confirms a pregnancy sac.
So you're around like 6-ish weeks for the most part.
This can be seen, the heartbeat is going to be seen typically around 6 to 7 weeks. It takes patients a little bit of wait. So you have to kind of be patient.
Keep an eye on it.
We all want to see what you want to see too. So just be patient. Try not to stress yourself out. Ultrasounds are usually very clear. Usually we can see things very well from a transvaginal perspective, and
we have a TV in there too, so you can see it.
You see it on TV. You'll be able to. The tech will explain, hey, you know, this is what you're looking at.
It'd be worth celebrating though, even if you see the yolk sac in there. I'm sure you'd want to. Our tech celebrated with them, so at the time, if you want to. But so I'm gonna go ahead and move on to the next one. So this is gonna be about accuracy. Ultrasounds can tell you exactly how many eggs you'll get during IVF. So this is during monitoring. Is that a fact or a myth?
That is a myth. This gives us a great estimate by counting follicles, but not every follicle produces a mature egg. And so it's not 100% predictive. And so
I think that's why it has to be consistent, right?
Yeah, this is why you have follow-up exams, because it's not 100%.
Yeah.
If it was, everybody would just be like one and done.
It would be seriously. Okay, well, I mean, do you have anything else you'd want to add, maybe, to our discussion? If not, those are all my questions. If you guys have questions, if you're listening, you could always give us a call. You could check out our website.
Yeah.
We have partners that we can always ask, for clarification for you also, if that's what you're needing. But so this was fun.
Yeah, very fun.
Yeah.
Very interesting.
We had 8 rounds of different facts and different myths. Well, actually 9 rounds. And I think a lot of people will benefit from the things that we talked about today.
I think hopefully some of the Q&A, the myths and facts will help dispel some of the anxiety about it. And I think that's really the bigger takeaway from this is not to be fearful. Ultrasound is safe. You can kind of relax. When you get here, we want you to be relaxed.
We try to make it like comfortable and the environment.
I think that's one of the things that patients like about coming here is it does feel like home.
Yeah,
they feel comfortable. They get to know the staff.
Yeah.
And so that constant engagement that they feel comfortable with, hopefully keeps them in a relaxed state and kind of stress-free, and they don't have to worry as much when they get here.
I agree.
Sorry.
But so thank you, Christopher, for walking us through that today. And thank you to all you who are listening. And then stay tuned. We're going to be doing our IVF series for the next few weeks. So it'll be next Friday. You can listen to our podcast on Spotify. You can find us on YouTube as well. You can follow our socials, which you can also find on our website at ultrasound-services.com.
Thank you for hosting this.
Yeah, of course. We'll see if I'm here next week or not. Maybe we'll have a tech. We'll see.
I may not be here next week.
Oh, true. I might still be hosting, but it'll be
we don't know. We don't know. Don't forget to check out our website for our IVF monitoring packages.
Yes.
Discounted rates.
The fertility first step, all of that.
Thank you. I was just going to say that.
Okay, well, we wish you all a wonderful weekend and have a good week next week as well.
Happy weekend.
Bye.